Hi, Peter Allen's Bigger Transformations, and what I want to talk to you about today is good angles and so-called bad angles. Part of this too is to kind of document how my improvements are coming with the percussion therapy. So I'm a little sore today from playing basketball with my kids the other day, but I'm going to try and demonstrate as best I can. I've already noticed an improvement on my right leg in terms of kind of where the hip is landing. So again, what I've been doing is loosening up the tissue in my right glute, as well as trying to get my adductors firing a little bit better. And I can already notice that my knee's kind of going much straighter than it used to. So when we're front lunging, whether it's a front lunge or a reverse lunge, when I land, I want to make sure my foot and my knee are going in the same direction. Ideally, I want to keep my hips as level as I can. All too often, a lot of people aren't realizing when they're lunging, they're crossing over and they're getting thrown off balance. It's much harder to balance on a balance beam than it is to on kind of like, let's say, 2 train tracks. So when I lunge, I want to make sure that I'm going straight. This knee should be straight, much better than it ever was. I'm kind of keeping all my weight on the front leg and driving. Now, we can either go forward or backwards. So I'm going to go right leg again. I'm going to go into this and I'm going to push back with my heel. And I'm going to switch left. Again, I want to try and get down to at least parallel or 90 degrees when I'm doing this. So a lot of times, front lunges, in some ways are easier, but they put more pressure on the knee than doing like a reverse lunge. But reverse lunges are a little bit more on the balance side. So when I land, I want to make sure my weight's already all the way over this, okay? A lot of times people are landing kind of too short, especially when they're trying to push back. They're almost sitting back into this. Now it's more of a pull than a push. Again, it puts a lot of pressure on the knee as well. Now, same thing if I'm reverse lunging, I want to be on my balance position. I kind of hinge, and I come down on the ball of the foot in the back, and I descend basically straight down, if you will. And then I come straight back up. Now, I use reverse lunges a lot because, again, it works your balance. It's a little better on the knees if you're having knee issues and whatnot. Also helps you with kind of awareness of where the bodies are moving. So I'm going to keep with the front one first. So I'm coming in, coming straight down, driving through the heel. I'm going to switch. Now, for some people, you might find it easier to kind of come off at a slight angle. Because again, a lot of times people are doing this kind of cross, and they're not really realizing where their angles are. A lot of times, a lot of people are pushing off that back leg. So if I'm in this position, my weight is on my back leg. I'll show you this side. From here, I'm using this leg. I can't use this leg. Okay, all my weight's on this back quad. And that's what I'm pushing off of. So when we're exercising, you got to start to understand that angles are kind of everything in terms of what you're trying to achieve or what we're trying to do. Sometimes, again, we just don't realize where we are. That's why I want to start recording kind of my training sessions with my clients so they can start to see where they're going wrong, how we can fix it, and kind of build more awareness. Because myself included, unless I sometimes look in a mirror or look at a recording, I don't know where I am. I can think I'm doing it perfect and then realize that I'm not. So a lot of times when people are squatting, for example, they're coming down, they think they're getting lower and they're doing this. So eye level can kind of trick us sometimes because, again, we think our legs are still moving and we're not realizing I'm not getting lower, I'm just moving my trunk and my torso. Ideally, again, if I want to squat, I should be trying to stay as upright as I can. I'm dropping straight into this, coming straight out. Okay? Especially if we're using a weight. I always recommend for my clients and people, you want to be able to get all the way down into, I know what's considered a bucket squat, okay, before I start adding weight. Because if I can't get into a bucket squat without weight, then I'm definitely not going to be able to get into it with weight. Now, sometimes weight does help us, but we got to also realize we're compensating for something if we can't get down there without the weight. So, in something like this will really kind of tell you how tight your glutes are in some ways. Could be a secondary too that's kind of holding you back. A lot of times, again, I think it's the glutes and our tightness. Again, we're thinking we've got tissue back here, so everybody's thinking, myself included for years, like, oh, the glutes are fine, the glutes are fine. Not realizing those deep ones are really kind of restricting our movement, and my right hip got sucked in. So a good angle on a squat is, again, I want my knees slightly over my shoelaces, as upright as it can be, and coming up. Okay? Now there's different ways to kind of make this harder. Okay? In the beginning, sometimes it's easier to keep your hands out, okay, to help throw off the balance or kind of create more balance, which again is fine. And sort of cheat as long as we're promoting better movement pattern as opposed to cheating just to kind of be able to get down there. And for those of you who can't get all the way down, it's better off kind of getting to here, trying to be upright. Now again, if you're having issues with your range of motion, I suggest start kind of percussion gunning your kind of glutes. Now you can kind of do this from kind of hinging over and leaning and finding what is the tightest area. You can do it from a chair like I've shown before. You can do it kind of leg over. There's a bunch of different ways that you can start to do this to loosen up your hips, because your glute controls your femur, and that controls your angles the most. If you think about it, we're kind of always focused on our quadriceps or hamstrings and not realizing, well, our hip is what dictates how much hamstring, how much quadricep we use, as well as the angles. Now, same thing if I was kind of hinging over, a couple different ways to do this. My core tight. Now I can kind of lean forward. I'm going to get a little bit more of a pull personally kind of up here, get a little bit more on the gastrocs. This is a great way to stretch. A little bit more weight on the balls of my feet. I'm just kind of slowly letting myself down. Now if I was lifting something heavy, I wouldn't want my back to round. Okay, I want to keep it flat at back. Okay, so if I'm doing a deadlift, I want to be here. Okay, that back should be at a nice kind of 45-degree angle. I know a lot of the best angles in exercise, in my opinion, are those 45s. If you again think about it, it's kind of got some of the most power in terms of coming out. Now again, you can kind of shorten the angle, and sure you're going to get more, but we don't always want to train in those short, tight angles because they're going to teach us to always be there, as opposed to again kind of working our better, bigger angles about a 45-degree. 90, you start to kind of, depending on the movement, bring in secondaries that you may or may not want to bring in. A lot of the legs are about 45, if you will. So again, if I'm deadlifting, I'm coming straight down, straight up, straight down, straight up. Now again, it's a great overall exercise, but you got to make sure that you're able to complete your full ranges of motion. All too often, I'm kind of seeing people deadlifting, and they're like this. And they're just, I mean, you're just pulling a ton with your back. And again, where we're losing our flexibility is our hips. That's what gives us our best angles. It's what's fixing my angle with my right leg the most. I've tried for years just kind of trying to work it out, lunge it. I did all these kind of crazy Bosu lunges, one-legged lunges with the TRX. There's plenty of different ways to challenge the body in terms of strength. But we first got to understand what are the angles that we want to be in, what is our body posture, and then we can really start to kind of push our body's limits and kind of do some of these other more advanced movement patterns, if you will. Over the years, I started realizing I was doing too much advanced work and not enough kind of base work. And over the years, I got tighter and tighter. So think of the angles that you should be with your lower body, okay? 45, back here, again, driving up. Most of this should just happen, okay? I realized over the years, focusing on telling people to fire from the glutes, fire from this, fire from that. If your body is at the right angles and the muscles are not too tight, the right things will happen, regardless if you're feeling them or not. But a lot of times, we're just too tight, and that's why we're not feeling the things the way that we should. And then what's happening is we're tensing and thinking we're getting more out of the movement than we are. Now we're taking that tense and we're carrying it outside of the gym with us into our everyday life, when we should be exercising so that we move better outside of here instead of tightening ourselves up. And now after a workout is where, again, I would use a percussion gun to kind of loosen up kind of any of the key areas that I worked. That's when your fascia is the most malleable and easiest to facilitate better movement, better strength. Again, I would even do it later. The more I think people start to realize what can be done with a percussion gun, and if we do this systematically and with a better understanding of what's happening with our body in terms of the scar tissue and our tightness holding us back, then we're all going to start to kind of really achieve results and everything else that we're thinking, and we're going to be less hindered by injury. I think that's what everybody fears, is injury. That's even why they start exercising, is because of that fear factor. Maybe I'll do a thing on fear factor in a second. But legs, angles, check them, video record them, do whatever you can. Thank you.